How to dominate NREMT static cardiology in just 7 steps. My name is Dave from Medic Test Secrets, and in this video I want to cover how to prepare for NREMT static cardiology in just 7 steps so you can successfully pass on your first attempt. Let's get started. So this is what a card would look like at the static cardiology station. Usually you're sitting at a table across from your examiner, and then they will hand you these cards. You get 4 cards in total, and you have to read the scenario, identify the rhythm, and then how you would treat the rhythm. If you're preparing for static cardiology and you're trying to figure out the best way to prepare, you're probably looking at the skill sheet, right? There's nothing on there. The skill sheet's blank. There's no critical fails. It can make it really difficult to figure out the right way to prepare for the station. So I just want to run through what the steps are so you know how to prepare easily. So step number 1, the station, right? You have to have an understanding of how the station works. You have to understand the rules. You have to understand the flow. And that way, as you're practicing your scenarios, you're practicing the right way. So for example, static cardiology, right? You have 6 minutes to interpret 4 arrhythmias. Right, so you get 4 cards, you have to read the scenario, you have to identify the rhythm, you have to voice treat the rhythm, and then you have to go through all the cards doing the same thing. So what do you need to know in order to do well with static cardiology, right? So once you know how the station works, next you have to look at what core concepts are necessary when you're preparing. So step number 2 is 4-lead ECGs. This is a big one. You have to be able to look at a 6-second strip of a 4 or a 3-lead ECG, and you have to interpret it quickly, right? So that is like the basis of static cardiology is 6-second EKG strips. So you want to be quick to identify them, you want to know the different rhythms, and really be comfortable with 4-lead rhythm identification. Step 3 is 12-lead ECGs. There's a possibility, not a guarantee, but a possibility that you could get a 12-lead ECG as one of your rhythm strips. So with a 12-lead ECG, you want to make sure that you are able to identify any arrhythmia, which is the underlying rhythm, but also you have to be able to localize and identify any signs of ischemia or infarct, right? You have to be able to localize ST elevation and say, okay, this is an inferior infarct or an inferior STEMI. And for 12 leads, you have to really communicate both of those aspects, right? So if there's an underlying arrhythmia, like a heart block, and if there's an inferior STEMI, you have to be able to recognize both of them, identify both of them, and then treat both of them, including treating the arrhythmia if it's necessary, and treating the ACS or the acute coronary syndrome with aspirin, possibly nitro, etc. Step number 4, ACLS algorithms. So you have to know the ACLS algorithms: tachycardia, bradycardia, cardiac arrest. You have to know them like the back of your hand so you can regurgitate them quickly, because the ACLS algorithms are what we're going to use for our answers in this station. Step 5, ACLS rhythms. Just like 4-lead ECG, you have to know the various ACLS rhythms, right? SVT, ventricular tachycardia, ventricular fibrillation, the heart blocks. Any rhythms that are listed in the ACLS provider manual is probably what you're going to see in static cardiology. Step number 6, ACLS drugs. So you have to also know the ACLS drugs that are listed in the ACLS provider manual and when to use them and what arrhythmias they treat. Because again, when you are voice treating the rhythms, you're going to be using the ACLS algorithms, which include the ACLS drugs. But I added this as a separate step because you have to know the dosages, you have to communicate the dosages, so you really have to have a deep understanding of the various ACLS drugs. Step number 7, communication. You have to communicate your answer in an organized fashion. You have to have a system in place or a format that you are using to communicate the information, because with the psychomotor exam, a lot of people have never taken it before. Some people have to take it twice, but if it's your first attempt, chances are you're probably going to be super nervous. Everybody is, right? It's not something that we do all the time. And when you get nervous, it hinders your ability to think as well as you normally would be able to. So when you are practicing these scenarios and you're practicing static cardiology, if you voice treat the rhythms the same way every time and you have a format to follow in an organized fashion to communicate this information, you will do better. Because when you're nervous and your brain is racing and your palms are sweaty and you're feeling nauseous because you don't want to fail, you will fall back on the stuff that you learned and practiced over and over again. So again, these are the steps. Step 1, you got to understand the station. You got to know the ins and outs of it and how you can use that to your advantage. Step number 2, 4-lead ECGs, be able to interpret them. Step 3, 12-lead ECGs, be able to interpret any arrhythmias as well as any ischemia or infarct. Step number 4, you have to know the ACLS algorithms and know them well. Step number 5, you have to know the ACLS rhythms and how to treat them with the ACLS algorithms. Step number 6, make sure you know the drugs and the dosages. And step number 7, make sure you have a format to communicate the answers back with your skill examiner on test day. And if you follow these steps when you're preparing for static cardiology, these are the keys to static cardiology success. If you got any value from this video, please go ahead and hit the like button so I know that it was helpful to you, and subscribe down below for more videos.